So we're fortunate to have Dr. Brian Levy with us here today, and Brian, I've known you for several years now, and we first met when you were Chief Medical Officer at Bausch & Lomb. And what's interesting as I've gotten to know you is you've had quite an interesting path getting to that level, in industry. So what I was hoping you can share is kind of the path you took, and kind of what was the decision that took you down the path into industry.
Sure. Well, it was completely unintentional, but it went there. Right. And if I look back, I can tell you what the path was, and it was a very interesting journey. I can tell you that much. So when I finished optometry school, I basically decided to do postgraduate work, and I went to the University of Waterloo, and I did a very interesting project as part of my postgraduate dissertation, which was in comparative anatomy of the eye, as well as comparative physiology of the eye. And the species that I was working on was a bird, believe it or not. And the physiology I was looking at was accommodation. And the problem was birds that dive underwater, how do they manage to accommodate? Because when they dive underwater, you lose your cornea. It means you've got to accommodate somewhere around 45, 50 diopters. And what I did was discovered how these birds actually managed to do that. What it taught me was the scientific method. And I think the scientific method and, being comfortable in writing grants and putting publications together is kind of what spurred me into the rest of my career. So that was probably, if I look back, the most important thing that I did. I then ran out of money, and so I went into practice, and I opened a practice in Toronto. Developed a very successful practice in Toronto. I was there for 10 years. And that gave me a couple of very, very interesting viewpoints into the industry, the eye care industry in general, because I was working in a completely managed care environment. So Ontario was a completely managed care environment, and I learned a lot about reimbursements, how the systems work, the values and the pros and cons of universal healthcare versus private things that happen in between, like balanced billing. So I went through all of those while I was in Ontario. So that was another good learning experience for me. At the same time, I kept up my research. I used to go down to Waterloo one day a week from Toronto, and I continued doing research. So I became what you can call a research clinician. I saw patients, but at the same time I was doing research, I was publishing. And where that became very valuable for me is a lot of companies then started to get in touch with me about being a clinical researcher for their products. That again adds to your ability to do good clinical research. So now I'm moving from basic to more clinically applied research. And at the same time, it's a good income generator. Seeing patients is definitely the prime reason most people become optometrists. I think as a primary care clinician, there's a lot of opportunity to become a researcher as well. Companies in general are always looking for optometrists to be researchers. Good clinical sites are very, very valuable, and they are very, very good in terms of reimbursement.
So key message there we have a lot of students and young ODs in our audience. Key message there is you can do both. You can parallel path and kind of keep one foot in in both sides until you're at that point where you can commit to one direction.
Right, absolutely. And publication. I continue to publish, and once you start doing that, you start getting invited to speak. And so I got invitations to speak all over the world about different aspects, particularly in the contact lens world, which I was heavily involved in at that time. I got involved in development of new products, which was very interesting. And that's kind of what sparked my interest in industry is, seeing new products being developed. I actually found that to be very fascinating. So that definitely is something that I would encourage, particularly young ODs, people getting into practice, as something to consider.
So that experience where you started working with new products, was that the trigger point where you said, I want to industry and research, that's where I want to go?
No, I didn't actually even think that way. I just thought I like doing this.
You like doing both.
And I also like seeing my patients. And then what happened was a curious thing. I was at a meeting at ARVO. Now, ARVO is the Association for Research in Vision and Ophthalmologists. It's an organization with about 12,000 members, and it's really dedicated to science in the eye care industry. And it's a very scientific meeting. Another thing I did, which also really bolstered my career, is I took a course at ARVO. Typically, going to these courses, most people entering the course were either from universities or from companies.
Right.
I decided I'm going to pay for myself, and I'm going down, and I want to take, and it was called Epidemiology and Biostatistics in Vision Research. And what it taught me, beyond what I'd learned during my postgraduate work, was really applied clinical research, how to look at journal articles that are published even in the best journals, New England Journal of Medicine, Ophthalmology, British Journal of Ophthalmology, all these Lancet, all these fancy journals. And what we did, one of the best exercises I ever had at this course, was we had to go and read these papers and then come back and critique them and say, yes, it was a good paper, it was a bad paper, and so on. You wouldn't expect to see a bad paper in these journals, but believe me, every paper that the course leaders gave us was a really bad paper. Not all of us picked it up, but when we went through this as a group, I think I learned more in that session than about clinical research, publications, what really is valid data versus non-valid data. And I think that also spurred me into a whole new paradigm of how I look at things in the scientific world.
So you kind of perfected the process of getting insights, scientific insights, and then communicating it properly to the world.
Correct. And also looking at publications, papers that are published, and looking at them critically, and being able to say, not just reading the abstract and reading the conclusion and saying, good paper, but rather looking at the key aspect of that particular study, and that is the methods. Because if the methodology is wrong or bad, the rest of it, you might as well not even read the rest of the paper.
Sure.
And not too many people realize that.
Sure.
The other thing is, when you're a busy clinician and you're trying to read papers, it's not easy.
Right.
So you do tend to go to the conclusion
Right.
and say, okay, this is not a bad paper.
Sure.